Hi guys, what is TRT? TRT is the acronym for testosterone replacement therapy. What is testosterone replacement therapy? Well, put very simply, you need to have testosterone to replace the testosterone and HCG to replace the luteinizing hormone, that is the pituitary hormone that is released to stimulate the Leydig cells of the testicles to produce testosterone. That's normally it. So a good TRT protocol, or should I say a gold standard TRT protocol, should be testosterone and HCG. Now, how do you know if you need testosterone replacement therapy? Well, number one, you need to have the symptoms. So low mood, poor cognitive function, low libido, erectile dysfunction, loss of muscle mass, increased visceral fat, etc., etc., etc. Then you need to have quantitative markers to support that diagnosis. So essentially blood tests. Now, there are lots of blood tests that you should have done. They obviously include testosterone. But testosterone only shows part of the picture. So you can't actually utilize testosterone. You actually utilize free testosterone, estrogen, and DHT. That's what's bioavailable. That's what your body actually uses. So we measure free testosterone and estrogen. We don't tend to measure DHT because number one, it's an expensive test, and number two, rarely do we ever have any issues of excess DHT. So what are the symptoms of excess DHT? Well, you can potentially have prostatic symptoms, so getting up to go to the toilet at night time, urinary frequency, etc., and worsening of male pattern baldness. Unfortunately, I don't need to worry about that anymore. Those days have passed. So yeah, it's more involved than that, obviously. The other thing that you need to look at are your pituitary hormones. So luteinizing and follicle stimulating hormone. Now, they give you an idea about what type of hypogonadism you've got. So if you've got a primary picture, in essence, is a problem with the testicles, you will have a high LH and FSH because the pituitary is trying to compensate for the lack of testosterone. So it's firing down to the testicles, but the testicles unfortunately are not responding. The other type of hypogonadism, stroke testosterone deficiency syndrome, is a secondary picture. Now that's far more common. Now, what you tend to have here is a low LH and a low FSH. Essentially, your brain is not responding. Now, that can be from a number of causes. So, common things that guys present with is either use of anabolic steroids, long-term opiate use, recreational drugs in the past, people having head injuries, sort of causing concussions, etc. These are common reasons why people have a secondary hypogonadal picture. Unfortunately, this world that we live in is pretty bloody unhealthy. So irrespective of not having been a naughty boy in the past, there are lots of guys who have actually got a secondary picture through, it appears, no fault of their own. And I think it's obviously to do with exposure to estrogens, BPA in the plastics, etc. And this peculiarity that we don't recognize that we're essentially an animal, and we've become so far removed from nature. It's shocking, you know. The further away we get, the worse our physical and psychological health gets. So, you know, you can't underemphasize the importance of sleep for the anabolic processes to predominate. You know, a healthy diet, a healthy lifestyle, getting lots of physical exercise. So before you actually consider going on testosterone replacement therapy, you need to establish a diagnosis or attempt to establish a diagnosis, you need to try and attempt to reverse a potential cause that would prevent you from needing to go on TRT. I mean, there are things like the thyroid. You know, if you have an underactive thyroid, that can cause a secondary picture. So it inhibits luteinizing hormone release from the pituitary. So you can have low testosterone because you've got an underactive thyroid. Treat the thyroid, don't need to go on TRT. If you have an overactive thyroid, then that causes an increase in sex hormone binding globulin. So SHBG prevents your testosterone from being used and you experiencing the qualitative benefits of what would otherwise be a normal testosterone. So what else? Prolactin, that's a super important one actually. It's important to measure your prolactin level before going on testosterone replacement therapy. Number one, because it can also mimic some of the symptoms of low testosterone. So, and they tend to be the libido and erectile issues. But prolactin has a very important role in inflammation and immunity. But the big one is you want to make sure there isn't a prolactinoma, so a space-occupying lesion that is pressing on the pituitary and causing your LH and FSH to be low, which is subsequently causing you to have low testosterone. So before considering testosterone replacement therapy, you need to have the relevant diagnostic workup. You need to address your diet, you need to address your lifestyle, and you need to address your physical exercise. TRT, testosterone replacement therapy, is a commitment. So it's not something to be entered into lightly. There is a titration process involved. So there is no one-size-fits-all model. You know, your dose will be different from my dose and blah, blah, blah. You know, and the effect testosterone replacement therapy has on your body can differ from person to person. So, you know, there are even genetic markers that we need, if we could look at, would be useful, but it actually wouldn't be actually particularly helpful from the perspective that you would still have to trial TRT to find out what effect it has on your body. There are so many variables involved. It's you can't have this one size fixed all model. It just doesn't make sense. So here at the Men's Health Clinic, we personalise your testosterone replacement therapy protocol according to your genetics, your physiology, and your needs. We like single esters because they're easy to control, and you don't tend to have as many side effects as you can have with a blend that some of the other providers use, which is, you know, whatever. Yeah, before I go off on a rant on that, yeah, you just we prefer single esters and HCG alongside your TRT, which helps mimic the luteinizing hormone, which has an effect not only on fertility but also an effect on the LH receptors in the brain, bringing about a qualitative improvement in things such as libido, which is obviously important. And there's also upregulation of the other hormones down from the cascade from pregnenolone down to cortisol, aldosterone, and testosterone. So if you want to have a puritanical viewpoint on TRT, it should just be testosterone and HCG. Unfortunately, that isn't always practical. As already discussed, this world is pretty unhealthy. Now, if there are reversible things that you can address, say, you know, you're prone to aromatization because you're a chunky monkey, or you're prone to aromatization because you're a boozer, then funnily enough, it's an idea to address those factors, which would hopefully, we're always aiming to get you down to the bare minimum of drugs that you need to take in order to feel the qualitative benefits. So less is more. we're not sacrificing anything by less is more, because the reality is your perfect TRT protocol is particular to your physiology and genetics and needs, as already stated. Hopefully we're over this garbage of more is better, and you're more alpha with a higher testosterone, you're more of a stallion with a higher testosterone, because you're not. I've reduced plenty of alpha guys who have come to me with a sort of borderline high free Ts and said they have a little bit of anxiety, and their erections aren't quite so strong, and they say, well, listen doc, I need to be a bit higher, look at me. And you kind of go, listen, let's reduce the dose a little bit. Listen, trust me, I'm the doctor. Boom. And they come back and they go, oh doc, my erections are back, I'm calmer, I feel like me again. So when it comes down to the purpose of testosterone replacement therapy, it's essentially to make you feel like you again. No more, no less. It's not to make you believe that you can be Superman if you're not Superman. It doesn't work like that. Your genetics and your DNA are designed for you to be strong, and your DNA is designed for you to be able to procreate. So your ideal male androgen levels are your ideal male androgen levels. You shouldn't want to be a particular number. I will work with you to get you where you need to be. It is a work in progress. We need to work together. We offer a personalised service at the Men's Health Clinic, and we offer that for a reason, because it needs to be a personalised service. So work with nature, not against it. Understand what your role is, understand what your place is, and together we will make sure that you feel the qualitative benefits of having an optimized testosterone replacement therapy protocol that is tailored to your actual needs, not the perceived needs of the bros. Ta-da.